Hello, my name is Stephanie Parks, and I'm an occupational therapy assistant currently in school to transition to be a registered occupational therapist. Thank you for taking the time out to watch my presentation on cognitive behavioral tools of inclusion for adolescents with mild intellectual disabilities and developmental delays. A quick project overview. We're going to review intellectual disabilities and developmental delays, the transition process from adolescence to adulthood, life skills, occupational therapy, and cognitive behavioral therapy. Transitioning from adolescence to adulthood is marked by a period of taking on new roles and responsibilities. These include working, forming intimate relationships, living independently, and eventually creating a family. Two main types of transitional changes include institutional and developmental. Institutional transitions involve a status change as the individual transitions from one school environment to another, or transitions from a school to a job. For example, transitioning from high school to college would be the transition from one school environment to another. The second is developmental, which is focusing on the natural maturation process, including sexual roles. Failure to understand and incorporate both systems may result in various negative outcomes. Also, adolescents are expected to become self-sufficient and make independent decisions within this time period. And lastly, the transition from adolescence to adulthood is connected to generations, cultural, and social opportunities. For adolescents with mild intellectual and developmental delays, transitioning into adulthood successfully is more complicated due to limitations in emotional, cognitive, mental, and physical functioning. These disabilities and delays are usually present at birth or identified before the age of 18 and impacts the individual's intellectual, emotional, and physical development. Intellectual disability is characterized by differences in intellectual functioning, problem solving, and adaptive behavior. Adaptive behavior is being able to learn skills to manage daily challenges. And developmental disabilities are broader and encompass challenges of intellectual, physical, or both intellectual and physical. The transition of an adolescent with intellectual disability or developmental delay is complex because these individuals are expected to undergo the same psychological and social development like a typically developing individual. Life skills. Life skills are essential in helping an adolescent make the transition into adulthood and promoting independence. Life skills can be defined as abilities for adaptive and positive behaviors that enables individuals to deal effectively with the demands and challenges of everyday life. Studies have shown that performing life skills in different activities contribute to a higher overall quality of life and increase involvement within society. For life skills, we're not focusing right now on different vocational skills such as managing finances or getting a job. We're focusing on the life skills of emotional, social, and cognitive. These three elements have 10 specific life skills that are very important for the transition from adolescence to adulthood. For example, for emotional, it focuses on self-awareness, coping with emotion, and coping with stress. And this is very important to be able to cope with stress when you enter adulthood, when you're in different situations. The importance of life skills. So the importance can fall under 3 different categories. It can be benefits for the individual, benefits for employment, and benefits for society. For example, life skills benefit an individual by helping them problem solve, building confidence to be able to take on new challenges and analyze different situations to make a positive choice. And then for employment, you can focus on time management and leadership to be able to also work as a team, and then within society, life skills can bring cultural awareness. How does occupational therapy play a role with adolescents transitioning to adulthood and life skills? The purpose of occupational therapy is to increase a person's participation in daily activities and to increase their quality of life. It also focuses on using strategies to increase a person's participation in meaningful tasks. Also, occupational therapists help with barriers that affect a person's emotion, social, and physical needs. So, for instance, a person with intellectual disabilities, if they're having challenges with emotions, then an occupational therapist can focus on these elements to help with increasing their independence in adulthood. Now we're going to focus on cognitive behavioral therapy, which is a tool that can be used to help increase learning the life skills and transitioning into adulthood. So a little background history of CBT. Dr. Aaron Beck is the father of cognitive behavioral therapy, and the main purpose is to challenge and change a person's thoughts and behaviors to improve how they manage their emotions and assist with developing different strategies to solve different problems. And this whole theory is based on that our thoughts, feelings, and behaviors are all connected. So this core principle for this definition focuses on maladaptive cognitions contribute to maintenance of emotional distress and behavioral problems. So if we are thinking negatively, then our emotions are going to be negative and our behaviors are going to be negative. One main area to focus on with cognitive behavioral therapy is the cognitive behavioral therapy triangle, and this shows how what we think affects how we act and feel, and how affects our behaviors. So what we do affects how we think and feel, and then our emotions affects how we think and what we do. So all of these three elements are connected. So this is just an example. We always start out with a situation, and then we think about going into our thoughts. So for example, we may think and how we interpret a situation. So if someone gives us an angry expression, we might automatically think, what did we do? Or they're having a bad day. And then that goes into emotions and behaviors and how we respond. If we think it's more positive, that they're just having a bad day, then our emotions are going to be more positive and we can kind of ignore the situation, and then our behaviors, we can just go on about our day. How can we use cognitive behavioral with life skills? By changing adolescents' thoughts, they will also change their emotions and behaviors. By identifying irrational thoughts, which are thoughts that are untrue for that situation, can improve a person's mood and behaviors. Adolescents with intellectual disabilities or developmental delays have a higher prevalence of various psychiatric disorders. And according to a research study, between 25 and 50% of youth with ID or DD meet the criteria for a psychiatric disorder. This elevated prevalence includes anxiety disorders among youth with intellectual disabilities, and 10 to 22% meet criteria for anxiety disorders, compared to 3 to 7% among the youth who are typically developing. So there is a very higher chance, if you have intellectual disabilities or developmental delays, that they might endure a psychiatric disorder. Assisting with negative thoughts and teaching coping strategies to help manage cognitive behavioral therapy triangle will assist with gaining a better understanding on life skills. Cognitive behavioral therapy also helps the person make practical changes in their lives, which can help improve on how they feel and reduce some symptoms associated with depression and anxiety. So now I'm just going to talk about a few strategies that you can try to use in your classroom to help incorporate cognitive behavioral therapy in teaching life skills to be more independent. So the first is the cognitive behavioral triangle. So this is just a quick situation. You're going shopping. So you're thinking, I'm going to have a heart attack. You're feeling your heart pounding. You have difficulty breathing. And then your behavior, you leave the store. So that's more of a negative outcome. And so if we were to reverse this and try to make the triangle positive, then the outcome will be more positive. So this is just a quick blank. You can take a screenshot of it if you want to use it in your classroom, and incorporating the situation into any situation that one of your students is going through. And this is another worksheet. This focuses on breaking down the specific event, thoughts, feelings, and behaviors. The next strategy that can be used and implemented is cognitive restructuring, and this focuses on restructuring how the person is thinking. This process involves identifying a situation that leads to a negative thought and feeling, and then you examine what is true or false about the situation, and then the last step is developing an alternative or more balanced thought. For example, I failed a test. So the irrational thought is, I'm worthless and I'm stupid, and then that's going to resolve in being depressed. Or we can restructure that and think, oh, I failed a test. Then your belief is, I'm smart, but I just didn't study for the test and I can do better. And then there's no depression. So really working on how students are managing their thought process in different situations. And so we call these negative automatic thoughts. So changing our negative automatic thought, which is something that we just think instantaneously, by changing that first thought can help change our emotions and our behaviors. And these are a list of different types of negative automatic thoughts that a student might encounter. For instance, like all or nothing thinking, or different jumping to conclusions, trying to remap these types of negative automatic thoughts can help a child and adolescent be more successful in the future. The next is problem solving. So taking the student through a problem solving situation, you can focus on, again, it's like the triangle, but it's kind of a different map. So you're focusing on the specific problem, and then you're identifying the solutions, the pros and cons. You're selecting a solution, a plan. You put the plan in action and review. Having the student go through the cycle and actually personally problem solve for themselves will teach them how to in that situation, and then they can use it in the next situation. And then different ways to implement life skills into the classroom. You can use discussions, brainstorming, role plays, having groups to talk about it, educational games, storytelling, debate. So it's really important to incorporate these principles when a person in your classroom is feeling really negative about a situation. So putting all the pieces together, all professionals working with adolescents with mild intellectual disabilities should be given the tools to teach life skills. Maladaptive cognitive impairments about oneself, the future, or the world are more likely to lead to problematic behaviors and emotional distress. A primary goal of CBT is to identify and change false and distressing beliefs to handle situations more effectively. Changing one's thoughts process will increase one's confidence in learning life skills to increase independence while transitioning from adolescence to adulthood. Thank you so much for watching my presentation, and please don't forget to take the post survey at the end of the video. Thank you.